Those delays matter. Open the door. Leave it unlocked. Then return to your position. Because what comes next surprises many people. Do not lie flat on your back. Your instinct will tell you to lie down. Resist that instinct. When you lie completely flat, blood return to the heart increases, forcing an already struggling heart to work harder. Instead, sit upright with your back supported. If possible, bend your knees slightly. Rest your arms comfortably. Remain still. Breathe normally. Reduce the workload placed on your heart. Imagine a damaged engine climbing a mountain. Would you press harder on the accelerator? Or would you reduce the load until mechanics arrive? Your heart deserves the same consideration. Stay still. Stay calm. Conserve energy. And whatever you do, do not drive yourself to the hospital. I've lost count of how many patients attempted exactly that. Some never arrived. If your heart rhythm deteriorates while driving, you don't simply endanger yourself. You endanger everyone around you. An ambulance brings monitoring equipment, medications, oxygen, defibrillators, and trained professionals. Your car brings none of those things. But technique number 2 may be one of the most extraordinary examples of modern medicine hiding in plain sight. Because the tool I'm about to describe costs almost nothing, exists in millions of homes around the world, and has saved countless lives. Aspirin. Yes, aspirin. The same medication sitting forgotten in medicine cabinets everywhere. But to understand why it matters, remember what actually causes the heart attack in the first place. The clot. The platelets. The blockage. Aspirin interferes with platelet activation. Put simply, it tells those platelets to stop sticking together. It slows the growth of the clot. It buys time. And during a heart attack, time is everything. One of the largest heart attack studies ever performed demonstrated that early aspirin administration significantly reduced mortality. Think about that. One inexpensive tablet reducing deaths in one of the world's deadliest emergencies. Medicine doesn't often give us miracles, but sometimes it gives us something very close. However, there is an important detail almost everyone gets wrong. You do not swallow the aspirin whole. You chew it. Chewing dramatically speeds absorption. Minutes matter. Those minutes are exactly what you're trying to save. But medicine always lives in the details. And details matter. People with aspirin allergies should not take it. Patients with active gastrointestinal bleeding should not take it. Patients already taking blood thinners should follow the guidance of their own physician. Which is why I encourage every patient with cardiovascular risk factors to discuss emergency aspirin use with their doctor long before they ever need it. The best decisions are made before panic enters the room. But now we arrive at the third technique. And before I tell you what it is, I need to address one of the biggest myths circulating on the internet today. You may have heard of something called cough CPR. Perhaps someone sent it to you in a message. Perhaps you've seen videos claiming doctors don't want you to know about it. The idea sounds convincing. If you feel yourself collapsing during a heart attack, simply cough repeatedly and powerfully to keep yourself alive. It's dramatic. It's memorable. And unfortunately, it's deeply misunderstood. The truth behind cough CPR is much more complicated than social media makes it appear. Because while there are extremely specific hospital situations where monitored patients experiencing certain dangerous rhythms may temporarily benefit from directed coughing under medical supervision, that scenario is not the same thing as an ordinary person alone at home during a heart attack. And misunderstanding that difference can become dangerous, because every second spent coughing instead of calling for help is a second your heart cannot afford to lose. Which brings us to the real third technique, the one my patient used. The one that kept him stable long enough to reach the hospital alive. The technique almost nobody talks about. And the reason it works has everything to do with a battle happening inside your body the moment fear takes over. The moment your brain realizes something may be wrong with your heart, It does something that made perfect sense thousands of years ago, but can become incredibly dangerous during a heart attack today. It activates your survival system. Adrenaline floods your bloodstream, your muscles tense, your breathing speeds up, your blood pressure rises, your heart begins beating harder and faster because your body believes it needs to prepare for a fight or an escape. But during a heart attack, the enemy isn't outside your body. The enemy is inside one of your coronary arteries. And every extra heartbeat, every unnecessary contraction, every spike in blood pressure forces an oxygen-starved heart muscle to work even harder. Imagine trying to force a damaged engine to race uphill with almost no fuel left in the tank. That's exactly what panic does to a heart attack. This is why the third technique may sound deceptively simple, but physiologically, it can be extraordinarily powerful. Controlled breathing. Not because breathing exercises cure heart attacks. They don't. Not because breathing opens blocked arteries. It doesn't. But because controlled breathing can reduce the workload on a heart that is fighting for survival. Slow breathing activates the parasympathetic nervous system, often called the body's braking system. Through stimulation of the vagus nerve, it can help lower heart rate, reduce stress hormones, and slightly decrease blood pressure. In other words, it helps your body stop pressing the accelerator while your heart desperately needs the brakes. The technique is simple. Breathe in slowly through your nose for 4 seconds. Hold for 7 seconds. Exhale gently for 8 seconds. 4 seconds in, 7 seconds holding, 8 seconds out. Again, and again, and again. Not forcefully, not dramatically, slowly, quietly, deliberately. While doing this, repeat something equally important inside your mind. Help is coming. I have called emergency services. I know what to do. I only need to stay calm until they arrive. That isn't wishful thinking. It's neuroscience. Studies consistently show that internal dialogue changes physiological stress responses. Patients who maintain control over catastrophic thinking often demonstrate lower stress hormone levels and more stable cardiovascular responses during acute medical emergencies. Your thoughts affect your biology. During a heart attack, that matters. And that brings me to another patient I'll never forget. Her name wasn't actually Margaret, but that's what we'll call her. Margaret was 72 years old and had lived alone since losing her husband nearly a decade earlier. She was a retired school teacher with the kind of quiet intelligence you notice within minutes of meeting someone. Months before her heart attack, she attended one of my community lectures on cardiovascular health. Unlike most people in the audience, Margaret took notes. Detailed notes. She programmed emergency services into speed dial. She placed aspirin in a clearly marked location in her kitchen. She rehearsed what she would do if the day ever came. Then one Wednesday afternoon, the day came. She felt pressure in her chest while reading in her living room. Not severe pain, pressure, a heaviness she couldn't explain. Then came sweating, then nausea, then that feeling patients struggle to describe but never forget. Something is wrong, very wrong. Margaret recognized the signs immediately. Within 2 minutes, she had called emergency services. She unlocked her front door. She sat down in her hallway chair. She focused on her breathing. 4 seconds in, 7 seconds hold, 8 seconds out. When paramedics arrived 9 minutes later, they found her conscious, alert, and remarkably stable considering what was happening inside her chest. She underwent emergency angioplasty. The blocked artery was opened. Blood flow returned. 3 days later, she called my office herself. I asked her what she remembered most about those moments waiting for the ambulance. Her answer has stayed with me ever since. Knowing what to do stopped fear from taking control. Not eliminated fear, controlled it. Because courage isn't the absence of fear. It's having a plan while fear is present. Knowledge gave her that plan, and knowledge may one day give you the same advantage. But knowing what to do is only half the equation. Knowing what not to do can be equally important. What if I told you that if a heart attack struck you in the next 10 minutes while you were completely alone, the difference between life and death might come down to three simple decisions made in the first 60 seconds? Not expensive equipment, not a hospital, not a doctor standing beside you, just knowledge. Because every year, millions of people die from heart attacks before they ever reach an emergency room, and most of them did not die because medicine failed them. They died because they didn't know what to do while help was still possible. Today, I want to change that, because one of my own patients used these exact techniques, and he survived. But before I tell you what he did, you need to understand why those first few minutes are so terrifyingly important. I'm Dr. Franklin, and after more than 2 decades of treating patients with cardiovascular disease, I've learned something that still frustrates me every single time I walk into a coronary care unit. The human heart is remarkably resilient, but when it begins to fail, it rarely gives you a second chance to make the right decision. I've sat beside patients who survived because they acted quickly, and I've sat beside families who arrived 10 minutes too late. The painful truth is that in many of those cases, the outcome was decided long before the ambulance ever arrived. One case in particular has stayed with me throughout my entire career. I'll call him Richard. He was 68 years old, retired, active, and by most people's standards, healthy. He walked every morning, watched his diet, attended his annual checkups, and took pride in staying independent. In many ways, he was exactly the kind of patient who believed heart attacks happened to other people. Then one Tuesday morning, his wife left to do some shopping, and Richard stayed home alone. About 30 minutes later, he felt an uncomfortable pressure in the center of his chest. Not pain exactly, just pressure, heavy pressure. He described it later as feeling as though someone had placed a concrete block directly on top of him. But because it wasn't the dramatic, movie-style chest pain everyone expects, he convinced himself it was indigestion. So he did what millions of people do every year. He waited. He sat down on the couch and told himself it would pass. But it didn't pass. Because while Richard was waiting, something catastrophic was happening inside his body. By the time his wife returned home 90 minutes later, Richard was unconscious on the living room floor. He survived. But survival and recovery are not always the same thing. The heart damage he suffered that morning changed the rest of his life. Activities that once felt effortless suddenly exhausted him. Climbing stairs became difficult. Walking long distances became impossible. His independence slowly disappeared, not because medicine couldn't save him, but because he lost precious minutes he could never get back. The question isn't what failed Richard. His heart didn't fail first. Knowledge failed him first. And Richard is not unusual. He is the rule. According to global cardiovascular statistics, heart disease remains the leading cause of death worldwide, and a huge percentage of heart attack victims die before ever reaching a hospital. But perhaps the most shocking statistic of all is this. The average patient waits between 2 and 4 hours before calling emergency services after symptoms begin. 2 to 4 hours. Now think about that for a moment. Cardiologists have a phrase we repeat so often that it almost becomes a reflex. Time is muscle. Every minute that passes during a heart attack means more heart muscle dies forever, not weakens. Not struggles, dies. And unlike your skin, your liver, or even certain parts of your body that can repair themselves, the heart has very little ability to regenerate damaged muscle tissue. Once it's gone, it's gone. So before I teach you what to do, you need to understand what is actually happening during a heart attack, because once you understand the mechanism, every decision that follows suddenly makes perfect sense. Imagine your heart as a city that never sleeps. Inside that city are billions of workers, your heart muscle cells, operating 24 hours a day, every day of your life, without vacations, without weekends, and without rest. Those workers need supplies. They need oxygen. They need nutrients. Those supplies arrive through highways called coronary arteries. For years, sometimes decades, cholesterol, inflammation, calcium deposits, and cellular debris slowly accumulate inside those highways. Most people never feel it happening. The process is silent, invisible, until one day, one of those plaques becomes unstable. Sometimes stress triggers it. Sometimes physical exertion triggers it. Sometimes high blood pressure triggers it. And sometimes there is no obvious trigger at all. The plaque ruptures. Your body interprets that rupture as an injury, and your blood responds exactly the way it was designed to respond. Platelets rush to the area to stop the bleeding. Except this time, there isn't external bleeding. The repair process itself becomes the problem. The platelets clump together, a clot forms, and suddenly, one of those highways shuts down completely. Traffic stops. The oxygen supply disappears. The workers inside your heart city are cut off. Then the clock begins ticking. Within minutes, heart cells begin dying. Within 20 minutes, some damage becomes irreversible. Within 40 minutes, the affected area expands dramatically. Within several hours, entire sections of heart muscle can become permanently destroyed. That's why every cardiologist becomes obsessed with speed, because speed saves heart muscle, and heart muscle saves lives. The good news is that modern medicine can often reopen blocked arteries astonishingly quickly. Procedures like emergency angioplasty can restore blood flow and dramatically reduce permanent damage. Some patients leave the hospital with hearts that function almost normally again. But there's a catch. Doctors cannot save the muscle they never get the opportunity to reach. First, you have to survive long enough to get to us. And that's where technique number 1 enters the story. In my experience, the first technique saves more lives than every other intervention combined. I call it the 60-second survival protocol. All not because it's complicated, because it's simple. Simple enough to remember under stress. Simple enough to perform while terrified. Simple enough to save your life. The first step is recognition. This sounds obvious until you realize it is where most people fail. Heart attacks do not always look like heart attacks. In fact, many don't, especially in adults over 60, especially in women, especially in diabetics. The classic crushing chest pain does happen, but many patients experience something much quieter and therefore much more dangerous. Pressure in the center of the chest, discomfort in the jaw, pain in the back, pain in the shoulder, pain down either arm, cold sweating, sudden nausea, unexplained dizziness, shortness of breath, an overwhelming feeling that something is terribly wrong. That last one surprises people, but experienced cardiologists hear it repeatedly. Patients describe it as a sense of impending doom, an instinctive certainty that something serious is happening. The body knows before the mind catches up. Ignore that feeling at your own risk. Because if you are over 60, have risk factors such as high blood pressure, diabetes, smoking history, elevated cholesterol, or family history of heart disease, and you develop symptoms lasting longer than 5 minutes, you should assume you are having a heart attack until proven otherwise. Not indigestion, not stress, not muscle strain, not anxiety, a heart attack. Because if you're wrong and call for help unnecessarily, you may lose a few hours. If you're wrong and decide to wait, you may lose your life. The second step is immediate emergency activation. This is not optional. This is not negotiable. This is not something you do after seeing whether symptoms improve. You call emergency services immediately. Not your daughter, not your neighbor, not your family doctor. Emergency services. Say these words clearly. I think I may be having a heart attack. I am alone. Those words immediately change the response priority. Stay on the line. Follow instructions. And then do something very few people think about until it's too late. Unlock your front door. I know that sounds almost ridiculous compared to everything else we've discussed. But emergency crews repeatedly encounter patients who collapse behind locked doors. Minutes are lost. Windows are broken. Entry must. Some of the most dangerous decisions patients make during heart attacks are decisions that feel completely reasonable at the time. Mistake number one is waiting to see if symptoms improve. This single mistake kills countless people every year. The chest pressure isn't too bad. Maybe it's indigestion. Maybe I pulled a muscle. Maybe I should give it another 30 minutes. Those 30 minutes can become permanent heart damage. Remember the phrase, time is muscle. Your heart does not care whether your delay felt reasonable. Mistake number two is attempting to drive yourself to the hospital. I've treated patients who made it. I've also treated patients who never arrived. If your rhythm deteriorates while driving, the consequences extend far beyond your own safety. Call emergency services. Always. Mistake number three is physical exertion. Some patients decide to walk around because they believe movement might help. Others try climbing stairs. Some even continue household chores because they don't want to overreact. Unfortunately, every movement increases oxygen demand. The heart asks for rest. The body responds with effort. The mismatch becomes dangerous. Sit down. Stay still. Conserve energy. Mistake number four surprises many people. Eating or drinking. If emergency intervention becomes necessary, a full stomach can complicate urgent procedures and anesthesia management. With the exception of aspirin when appropriate, avoid food and drink while waiting for medical care. Mistake number five is one of the simplest and yet one of the most important. Failing to unlock the door. Paramedics can only help patients they can reach. The difference between an unlocked door and a locked one may only be a few minutes. But during a heart attack, a few minutes can feel enormous to the heart muscle losing oxygen inside your chest. Yet perhaps the most fascinating thing about heart attacks is that many don't arrive without warning. The body often whispers before it screams. In fact, studies suggest that many patients experience warning symptoms hours, days, or even weeks before the major event occurs. These symptoms are called prodromal symptoms, and recognizing them may prevent the emergency altogether. Unusual fatigue is one of the most common, not normal tiredness, not the exhaustion after a long day, a deep, disproportionate fatigue that feels unfamiliar. Many patients describe feeling as though someone turned down their internal battery overnight. Particularly in women, this symptom is incredibly common and incredibly ignored. Another warning sign is chest discomfort during activities that never caused problems before. Walking uphill, carrying groceries, climbing stairs. Activities that suddenly produce pressure, heaviness, or tightness in the chest deserve immediate medical attention. Shortness of breath can be another warning. So can unexplained sleep disturbances. Some patients describe waking repeatedly during the night with anxiety they cannot explain. Others notice unusual palpitations or irregular heartbeats. None of these symptoms guarantee a heart attack is coming, but they may represent the heart asking for help before it begins demanding it. Listen carefully when your body changes its language, because prevention remains the greatest victory medicine can achieve. The heart attack that never happens is the best heart attack of all. So if you remember nothing else from this conversation, remember these three actions. First, recognize symptoms quickly and call emergency services immediately. Second, if appropriate and previously discussed with your physician, chew aspirin rather than swallowing it whole. Third, control your breathing and reduce panic so your heart can work as efficiently as possible until professionals arrive. 3 actions. 3 opportunities. 3 chances to change an outcome. But before we finish, I need to address something that may be even more important than everything we've discussed so far. Because surviving a heart attack often begins years before the heart attack itself. The people who do best after these events usually have something in common long before symptoms appear. And what they do every single day may surprise you. The truth is that heart attacks rarely begin on the day they happen. Most begin 10 years earlier, sometimes 20. long before the chest pain, long before the ambulance, long before the emergency room doors open, because every heart attack is usually the final chapter of a story that has been unfolding silently inside the arteries for decades. And strangely enough, the heart often gives warnings long before it gives ultimatums. The problem is that those warnings are quiet, a little more fatigue than usual, a little less stamina walking uphill, a little more shortness of breath carrying groceries. Most people explain these things away. I'm getting older. I'm out of shape. I didn't sleep well. I'm stressed. And sometimes they're right. But sometimes those explanations become the most expensive assumptions of their lives. One of my patients, whom we'll call Daniel, taught me that lesson in a way I will never forget. Daniel was 64 years old, successful businessman, worked long hours, rarely complained. His first symptom wasn't chest pain. It wasn't arm pain. It wasn't even shortness of breath. It was fatigue, crushing fatigue. The kind of exhaustion that made him want to sit down after climbing a single flight of stairs. For 6 months, he ignored it. He blamed age. Then he blamed work. Then he blamed stress. But the fatigue slowly worsened. Eventually, he noticed something else. Every time he walked uphill, a strange tightness appeared in his chest. Not pain, pressure, the kind that disappeared the moment he stopped walking. Again, he ignored it. Because it wasn't severe. Because it always went away. Because humans are remarkably good at explaining away danger when danger arrives slowly. Then one afternoon, while carrying groceries into his house, the pressure didn't disappear. It intensified. Within 20 minutes, he was in an ambulance with a major coronary artery completely blocked. Fortunately for Daniel, the story ends well. He survived. The artery was opened. The heart damage was limited. But when I visited him afterward, he asked me a question I hear over and over again. Doctor, was my body trying to warn me? The answer was yes. Absolutely yes. His body had been warning him for months. He simply didn't know how to listen. And perhaps that's the biggest lesson in all of cardiology. The body whispers before it screams. Learn the whispers. Because whispers give you options. Screams often give you emergencies. So what are those whispers? Persistent fatigue that feels different from ordinary tiredness. Shortness of breath during activities that once felt easy. Chest pressure triggered by exertion. Jaw discomfort while walking. Shoulder pain that appears during exercise and disappears with rest. Sudden reductions in exercise tolerance. Unexplained nausea during physical activity. Palpitations that appear without explanation. These symptoms do not automatically mean heart disease, but they deserve respect, and they deserve investigation, because a simple electrocardiogram, stress test, or cardiac evaluation performed early may prevent a future catastrophe entirely. And prevention changes everything. A blocked artery discovered in a clinic is an inconvenience. A blocked artery discovered during a heart attack is a crisis. The difference between those two moments is often awareness. But awareness alone isn't enough. Preparation matters too. If you are over 60, ask comfortable questions. Do your family members know your medications? Do they know your allergies? Do they know your medical conditions? Could emergency responders enter your home quickly if they needed to? Do you have emergency numbers programmed into your phone? Would you know where your medications are in the dark? Would your spouse know? Preparation feels unnecessary right up until the moment it becomes invaluable. Margaret understood that. Richard didn't. One survived with minimal damage. The other lived with permanent consequences. The difference wasn't luck. It was preparation meeting opportunity. And there is one final myth I want to destroy before we finish. Many people believe heart attacks happen suddenly without warning and without reason. That simply isn't true. Heart disease is not fate. Genetics matter. Age matters. But choices matter too. Blood pressure control matters. Exercise matters. Sleep matters. Smoking matters. Diabetes management matters. Diet matters. The heart remembers what we repeatedly give it. Years of care become resilience. Years of neglect become vulnerability. And that means every healthy decision you make today becomes an investment in a future version of yourself you may one day desperately want to protect. Perhaps the most remarkable thing about the human heart is not its strength. It's its loyalty. It beats more than 100,000 times every single day. It works while you sleep. It works while you complain. It works while you ignore it. It asks for very little in return. And when it finally asks for help, it deserves to be heard immediately. So let's burn these 3 techniques into memory one final time. Recognize the symptoms quickly and assume the worst until proven otherwise. Call emergency services immediately. Unlock your door, sit upright, and stay still. If appropriate and previously approved by your physician, chew aspirin rather than swallowing it whole. Control your breathing. Slow the panic. Reduce the workload on your heart. And remind yourself that help is already on its way. 3 techniques, 3 decisions, 3 opportunities to change the ending of a story that has ended tragically for far too many people. And if you remember nothing else from this video, remember this. A heart attack does not care whether you're brave. It does not care whether you're stubborn. It does not care whether you're busy. It only cares about time. Protect time. Respect time. Because when it comes to the heart, time is not money. Time is life. If this information helped you, don't keep it to yourself. Share it with your spouse. Share it with your parents. Share it with your brother who lives alone. Share it with your neighbor. Because knowledge locked inside one person's head saves one person. Knowledge shared saves families. And somewhere, someday, someone you care about may remember one sentence from this video during the worst moment of their life. That one sentence may be enough to make them pick up the phone instead of waiting. It may make them unlock the door instead of lying down. It may make them stay calm instead of surrendering to panic. And that single decision may allow them to sit at another birthday table, hold another grandchild, celebrate another anniversary, or wake up to another ordinary morning they almost never got to see. As physicians, we save lives with procedures, medications, and technology. But sometimes we save lives with information delivered before the emergency ever begins. Today, that information belongs to you. I hope you never need it. But if the day ever comes, I hope you remember every word, because your heart will be counting every second. And now, so will you. This video is intended for educational purposes only and does not replace professional medical evaluation, diagnosis, or treatment. If you experience symptoms suggestive of a heart attack or any medical emergency, contact emergency services immediately. Always consult your healthcare provider before taking aspirin or making medical decisions related to your personal health conditions or medications.